Some conversations are like vitamins, they make you feel better. And some are like painkillers that make your pain go away. This health talk is a bit of both. Meet Dr. Kalpana
Hi, so I'm
Nagpal.
here today with Dr. Kalpana Nagpal. Thank you, ma'am, for taking out time for us today. And please tell our viewers something about yourself.
Hi, I'm Dr. Kalpana Nagpal, Senior Consultant in the field of ENT and head and neck surgery and robotic surgery. So I'm the lead robotic ENT surgeon for ENT in India, and also I started Women Association of Otolaryngologists of India 3 years ago. I'm the founder president of that, and we are more than 2,000 members. Happy to be here.
Thank you so much, ma'am. I'm so happy to be here with you.
In our health talk, we talked about common ENT problems. I also got to observe firsthand how she interacts with her patients and how much her patients care about her. So let's start.
So, ma'am, sometimes there is bleeding from the nose. So, what exactly is the reason behind that?
Yeah, nosebleeds can happen in children, it can happen in adults, and even in the elderly. Now, nosebleeds, several causes. Actually, there are congenital causes, there are acquired causes. You know, there can be mass lesions in the nose. No, it depends on what age group we're looking into. So in children, most often it's like, you know, except for a congenital condition that where you see a polypodal change, you know, in the septum, and that's the midline structure that is responsible for the bleeding. That's called the bleeding polyp of the nose, and you know, that's usually by birth. Now that needs to be treated surgically. Otherwise, majority of the children who are suffering from nosebleeds can be treated medically. Now, in the adolescent age group, there is a tumor called juvenile nasal angiofibroma, JNA. Now, this is a very dangerous condition to have because the patient can have severe bleeding episodes. In fact, this tumor cannot be biopsied also in the outpatient, so it needs proper investigations like a contrast MRI, and of course, then the surgical management. Then in adults also, you know, it can be simple causes like deviated nasal septum or nasal polyps, but there can be more severe conditions like inverted papilloma or malignancy of the nose. So one must go to the doctor to rule out all this. So a proper clinical examination, nasal endoscopy, and other investigations may be required. But yes, the nosebleeds can be fixed. There are many procedures, starting from simple methods like nasal packing, nasal cautery, to even severe, like major procedures like sphenopalatral artery ligation, etc.
Thank you, ma'am. Now I understand that nasal bleeds should not be ignored at all. We should visit an ENT specialist
Yeah, true.
for the same. Thank you.
Okay. I think
In between our